Good afternoon, I'm Dr. Mark Müller. I'm an ENT surgeon in Dubai, and I would like to contribute with this to the online symposium for COVID-19. I'm happy to talk a little bit about the COVID-19 impact on ear, nose, and throat diseases. The DHA distinguishes between the confirmed cases and the suspected COVID-19 cases. Confirmed cases are touching our field only through tracheostomy. The interest in my talk is on the suspected cases. Now, as we know, suspected cases should be those with upper respiratory tract symptoms and like cough and runny nose or sore throat and dry cough, husky voice, nasal congestion, but also middle ear problems with or without fever. And there has to be additionally a history of traveling to any COVID-19 hotspot country, or a contact with somebody who has been in contact with COVID-19 recently. The history is 28 days, so I think the UAE has been locked down already for the past 28 days. The travel history seems to be not so relevant, or less and less relevant, whereas the contact history is more and more relevant since the positive cases. So as COVID-19 as a general disease, not only of the respiratory tract and not only adding to this severe pneumonia, but also multi-organ impact, and it is proposed that this is due to its effect on the red blood cells. Therefore, also symptoms like vertigo and sudden hearing loss may be included in the wide spectrum of ENT symptoms that could be part of coronavirus 19. And anyway, it is mandatory for us to wear the PPE in all cases, and this is the double gloves, the plastic gown, the head cover, and goggles, and N95 mask. And also all our patients, also the vertigo patients, should wear an N95 mask or at least a surgical mask. And we should be careful when we investigate our patients, since we are very close to their respiratory aerosols, that we do not trigger their sneezing or coughing, especially when we investigate the ears or the nose with a nasal endoscope. That on the side, also we could have exposure to aerosol when we do surgeries with a microdebrider or driller. Here you can find online some nice methods how to use a plastic wrapping for the microscope and keep the aerosols at bay. In the light of all these symptoms that could be related to COVID-19, and in the light of the fact that the relevant history is always blurred and we do not really know if the patient had a contact to a COVID-19 positive patient, I think we should consider everybody possibly positive until we have proven another underlying cause of their symptoms, and or if we have proven that there's a positive coronavirus case. So the latter we can prove with the PCR test. As we know, the ACE receptors are very prevalent in the nasal mucosa and the nasopharynx and posterior pharynx. So it's advisable to gather as much as possible material from that region with a swab. Unfortunately, 30% of the PCR test results, test results, are false negative, so we need to repeat that test after 2-3 days. I don't know if I mentioned before that fever is not a mandatory symptom, so we should rely on COVID-19. Apart from that, we need some time to prove that a patient's symptoms are related otherwise, for example, to allergy or chronic sinusitis, bacterial infection, or a sudden hearing loss or so. And in the meantime, we need to give our patients some protection, and that's actually the main point that I want to make with this short talk. I give my patients vitamins and supplements along with the respective treatment. And the main supplement that I advise to give is vitamin C, obviously. I would advise to give at least 2-3 gram of vitamin C daily. There is no limitation upwards. And then I also advise to give vitamin D. I do not advise to give zinc unless patients are taking already hydrochloroquinolone. But what I do is I give my patients this Ipera, which contains these pouches. It's gel pouches, and they just use 2 of these pouches a day. Ipera contains 5-HMF, which has recently been proven to be a very effective substance for sickle cell anemia. And since the COVID-19 disease is also affecting the red blood cells, and in a similar way as it occurs in sickle cell anemia, I think 5-HMF can only be helpful to protect our red blood cells. And another ingredient is the alpha-ketoglutarate, which is a precursor of the glutathione, and both of these substances are very effective in radical scavenging and also the ammonia reduction, but also effective against interleukin 6, or not antagonist of interleukin 6, which is one of the strongest part of the cytokine storm. So I want to give my patients this kind of protection to keep them safe until I have the diagnosis, and I recommend you to give this as well. I hope I could contribute a little bit additional information to our COVID-19 symposium, and stay safe and healthy, and thank you very much for watching, and open for all questions. Thank you.